Hi, my name's Simeon Niel-Asher and welcome to Trigger Point of the Week. Today we're going to be looking at the subscapularis muscle. So on our 3D model, if I select the area of most referred pain, we can see some of the options here. And let's click on subscapularis. Okay, so the subscapularis is an important muscle. It's one of the four rotator cuff muscles along with supraspinatus, infraspinatus and teres minor. And it's an internal rotator of the humerus. Also, of course, the cuff itself helps to maintain the stability of the humeral head, pulling it inwards, backwards and downwards. Origin from the subscapular fossa and inserts into the lesser tuberosity of the humerus. Also, interestingly, some of the fibers of subscapularis blend with one of the lower layer of the sheath around the long head of bicep. In terms of its action, it, as I said, stabilizes the humerus, the humeral head, and it works along with the deltoid and the biceps and triceps. Now, the referred pain pattern is really interesting because classically, patients often report a pain in the back of the wrist. So it's one of those interesting muscles where the referred pain pattern is very, very distal to the actual muscle itself. The other area that we see a lot is this sort of axillary fold. The referred pain can also come up into the tip of the shoulder, the deltoid, and also, interestingly, into the kind of medial biceps as well in some patients. Of course, we'll see it where patients have rotator cuff tendinopathy. There is sometimes we get subscapularis tears. We see it a lot in the frozen shoulder, also or adhesive capsulitis, severe pain in the back of the shoulder, restricted range of shoulder movement, and also pain like when people are throwing or clicking. Sometimes also when people pop their shoulders and they get this kind of popping shoulder syndrome, it's well worth looking at subscapularis. Now, some of the causes we know are sports related, especially swimming front crawl, repeated kind of forceful overhead lifting from sort of suitcases above the head into those compartments in the planes. And also, especially after shoulder fracture, we tend to see a lot of trigger points developing post-operatively or post-shoulder fracture. In terms of the differential diagnosis, we're going to look at the other rotator cuff dysfunctions, also thoracic outlet syndrome because of this kind of referred pain. Sometimes also cardiopulmonary pathology. So this is the subscapularis. Interesting to note the really florid pain map that's associated with it. And again, a hugely important muscle. In terms of treatment, there are several treatment options, including needling, but we can work it. I actually tend to work it using its antagonist, using a trigger point in infraspinatus. But let's save that for another recording. Okay, I hope you've enjoyed it.